This patient came to see me for a second opinion regarding tooth number 30. You see anything strange here? Anyways, a patient says a couple of years ago, she received the filling. Okay, she received the filling. Afterwards, tooth started to bother her, tooth started to hurt. So she went and saw a dentist, and the dentist noticed this radiopacity in her bone. So patient says she freaked out. She thought it might be cancer, so she went and had an oral surgeon do a biopsy on it, and results came back as condensing osteitis. Okay, that would have been my diagnosis by just looking at the radiograph today. But I'm glad that patient got a biopsy and it came out as being something benign. Patient denies any trauma to the tooth, no history of orthodontics, no trauma, nothing. But this is what she has. So she sees a dentist, a general dentist, and the dentist does a root canal. And now the tooth started to bother her again. Tooth bothers her when she bites down on the tooth and aches sometimes. Ask the patient. Patient is a doctor, OBGYN. Her husband is an orthodontist, and he was with her also. And he was there when the dentist did the root canal. So ask the orthodontist husband, do you remember if the dentist who did the root canal used the rubber dam? He said no. He used cotton rolls and gauze, 2x2s, to try to isolate the tooth to do the root canal. I'm like, oh boy. And this root canal was done when? 2021. Well, what do you do? Get x-rays. So we got x-rays, because now you can see what's going on here, right? Most of the distal root is gone. It's all gone. And got a purchase sticking out. This is a panel before the RCT, and you can see the radiopacity there. This x-ray is from 2020, before the root canal. Radiopacity is still there, but look here. Horizontal fracture of the distal root was there already. This is 2021, immediately after the dentist had done the root canal. Again, you can see the horizontal fracture here.